So thank you guys for coming. My name is Ryland Austin, and I'm one of the physical therapists here at Smart Body. And basically tonight what we're going to talk about is not only physical therapy's role in headaches, but basically kind of headaches in general, and why they affect so many people, and why there's some very simple things you can do to help with headaches. A lot of people feel very helpless when it comes to headaches because of their chronic nature. You know, we suffer from them for, 20, 30 years, or sometimes we have one for a whole week. Some people get migraines for days on end and things like that. And so we kind of get a very helpless feeling with it, like nothing's going to help. And so a lot of it with headaches is just knowledge, just understanding and things like that. So we're going to kind of talk about a lot of those things. And besides migraines, we're also going to talk a lot about, tension headaches, or what we call cervicogenic headaches. So sort of the headaches for the rest of us who don't get the migraine headaches, but we get them just as often. So in general, we're going to start with just definition of headache. So what is a headache? So a headache, obviously, is any type of pain that occurs in the head. How about that? This is not a very specific term as far as headaches is concerned. Headaches is also not a diagnosis. Headaches are a symptom. So while many people, say, oh, I have headaches, and that kind of comes off as a type of diagnosis, really headaches are the symptom. So something is causing the headache. Headaches aren't something that we just get or have. Migraines, headaches are a form of the migraine attack. So a lot of, once again, that's getting back to the education and the understanding of what is causing my headache. There's many different types. So as we've kind of already started to talk about, you've got the tension, you've got the migraines, and then you've got the secondary. This is a small list. Again, it gets broken down into much more detail, but basically I just wanted to kind of break it down into these three general categories. Tension headaches being the cervicogenic ones. So I'm going to talk a lot more about those, but that's basically the muscle tension headaches that we get, the neck headaches. Start in your upper back or maybe in your neck after a long day at work, and they kind of come. Migraines, those are the ones that people tend to suffer with more as far as from when they were a child, or as they maybe hit middle age, or things like that. They really start to get the migraine headaches. And then secondary headaches are basically what we call like a rebound. So either something else that we're suffering from, whether it's a neurological condition, or whether it's, you just had rotator cuff tear, and so you've been guarding a lot, so the muscles get kind of tight and everything like that. That's what we'd call like a secondary headache. It kind of is coming from the other area. The one good thing to know, though, is that there are effective treatments for all types of headaches. Whether it is medication, exercise, diet, things like that, there is an effective treatment, and there's a lot of research out there on ways to treat headaches because so many people suffer from them. One of the hardest part, though, with headaches is determining what type of headache are you suffering from. A lot of people self-diagnose themselves with migraines, and so therefore would treat themselves as if they have migraines. That's not going to help you if what you're actually suffering from is tension headaches, and so on and so forth. So that's one of the roles that physical therapy can kind of play in on, is helping determine what type of headaches you're having from, or if you have a neurologist and things like that. The diagnosing part's getting a lot better as far as determining that. And with that is when we can really start to focus the management of the headache. So what direction are we going to go in with those type of headaches that you're having? So we're going to start with the tension headaches, or what I call the cervicogenic headaches. These are very non-specific. So, while there can be specific patterns to the headache, and I know it's hard to see on the little skull here, but basically, starting in the neck, and then it works its way up and around, kind of on the side of the head. You get a lot of people complain of eye pain and things like that, or on, just above their eyebrow, getting a lot of pain in those areas. That's typically kind of the wave of where you're going to feel a lot of tension headaches. But the key thing with tension headaches, two key things, is how they feel and what symptoms they don't have. How they feel, basically they're going to feel tight. It feels like pressure, like somebody is just sitting there and squeezing your head. That's typically the feeling of a tension headache. And really, it makes sense because tension headaches usually come from tight muscles. So the muscles kind of spazzing or getting really aggravated in a way. So they're going to give you that tight feeling in nature. The second key feature is that they lack severe symptoms, right? Migraines have severe symptoms such as nausea, vomiting, optical issues, things like that, light sensitivity. Those are what we would classify in more of a severe symptom. These headaches are going to lack those type of symptoms. That doesn't mean that you can't have them just as long or just as often. It's just a different type of symptom. And like I kind of had already talked about, typically related with tightened muscles. So either the upper back or the neck, posture, huge things. We're going to talk about posture in a little bit as being one of the main things. But basically kind of the back of the skull area there gets real tight. And you have a lot of nerves and a lot of blood vessels that travel through that area. So as those muscles get tight, your window that those structures travel through shrinks. We call it the suboccipital triangle. And you have very important structures that go through there, including your occipital nerve. And that triangle basically gets small. So instead of being, a big triangle, a 90-90 triangle, now you're getting down to a more smaller obtuse triangle. And so that pressure gets put on the nerves, that pressure gets put on the blood vessels, and boom, there's your headache. Your headache is your body telling you something's off, something's wrong. A headache, once again, is a symptom. So I'll give you some of the stats here for, tension headaches. Is about 30 to 80% of adults suffer from headaches. So obviously that's a very broad number, but the big number there is 80%, right? So basically everybody at some point has pretty much had a headache or gets headaches on a regular basis. 3% though get what we would classify as chronic daily headaches. And I'll talk a little bit more about what classifies that as a chronic daily headache. But in a sense, women are more prone to headaches than men. We see this also with migraines as well. I tried to find why, and I couldn't get a good answer on why women are more susceptible, other than every research study said women were more susceptible. So I'm going to take that as fact for now. Some studies said it was up to 6 times more likely in women than in men, and so on and so forth. So we may be able to, relay that off to stress being one of the issues, or it could possibly be body type and body structure as well, as far as musculature and things like that. But most people aren't going to get more than 2 to 3 a month. So they're going to get them kind of spread out. Usually it's going to be during stressful times, either work-related, school-related. Maybe you had a night or two where you didn't sleep very well, you were sick, or something like that. Your kid was sick. Those are going to be the times when most people are going to get headaches. And we would, not to say expect it, but that's not uncommon. But the highest rate is ages usually 25 to 55, both male and female. This is when the prevalence seems to be the highest as far as when you're going to suffer from them daily more often and monthly more often. This is also the time period when you're going to see the greatest intensity in headaches. So the numbers, 30 million people currently, they're estimating suffer from migraines, and about 10 million people also have chronic tension headaches. So while most people are going to have some type of tension headache, some type of chronic tension headache, there's more people in general that suffer from the migraine headaches. And this is a nice little chart. Basically, this is just starting the posture talk here. The left side is basically good posture. With good posture, you put about 12 pounds of pressure through your spine, through your cervical spine. That's about the weight of your head. Okay, so you're not really putting any increase in pressure down into your spine. The muscles aren't having to do any extra work. Everybody's happy. With just slightly letting that head go forward or coming off of that center line right there, you've already just about tripled the amount of weight going down through the neck. So now those muscles are having to work harder. They're having to work longer, and they're having to work in a way, because now the neck is forward, that they're not designed to work for. So they get very tired. Boom, you get headaches more often. And then all the way on the right, 42 pounds of pressure. That's basically what we would call forward head posture, which is becoming more and more common in today's society with things, computers, driving, reading, iPads, all these type of things, Kindles, phones, all these type of activities, which we tend to be spending more and more time doing, all cause us to bring our shoulders forward and our head down. And all that's doing is leading us down the wrong path. So getting to the types, as far as what I was talking about, that chronic versus episodes, chronic is defined as getting greater than 15 headaches a month for 3 months in a row. So basically having a headache about every other day for 3 months in a row, which I would definitely classify as being chronic. Episodic is basically anything less than that, right? So easy definition. Over here on this little chart, this is talking about sinus versus the cluster versus tension versus migraine. And I'm going to talk a little bit more about this besides that chart, but essentially what it's showing is that, you know, tension headaches are more diffuse. Migraines typically are only going to be unilateral or on one side of the head, one side of the neck. They're not going to typically spread around to the whole head, whereas tension headaches are going to be more front of the head, like I showed earlier, kind of wrapping around the ear. Sinus headaches, cheeks, nose, forehead, the eyes, things like that, very typical of a sinus headache. Clusters usually are going to be one spot hurts, you know, so it's not the big diffuse headache, it's like right there hurts. So what are some of the symptoms? So we kind of talked about this a little bit with the tension headaches. It's going to be that dull, aching, tight feeling of the squeezing and things like that. It's also going to be tenderness. The muscles are going to be very tender. So you're going to be like, oh, I need to go get a nice massage, deep tissue massage. Typically a deep tissue massage, you know, is actually going to make you feel a lot worse. You know, at first you're going to feel great, but then those muscles are going to turn right around and be like, yeah, that wasn't such a great idea. So I'm going to show you guys some self-massage techniques here in a minute that are going to really help to decrease some of the tension. But the key is basically you got to give these muscles some TLC, a little tender love and care, right? You need to use some heat, some ice, you know, drink some water, go sleep, you know, find a nice dark room, do something relaxing. These are the type of things that typically you're going to find more success with these type of headaches, even if it is something that's lasted for 3 or 4 days. Right? These are going to be the type of headaches that you're going to want to basically just kind of give it that tender love that the muscles are really wanting you to give to them. So what causes these headaches? You know, there's not one single cause. So kind of what I talked to before, it's a symptom, right? So there's all types of things that can cause headaches. And even with migraines you can get tension headaches. You know, you can get the cervicogenic headaches. So as I'm kind of talking, you know, and I'm really focusing on the tension headaches, a lot of this is related to migraines as well. The only difference really being the symptoms. Symptoms are really the only difference that we're talking about here. Symptoms with migraines are going to be much more severe, and you're usually with migraines going to have more of a medication associated with your management. Whereas with tension headaches, while there are some medications, a lot of people suggest, you know, NSAIDs and things like that. You know, tension headaches usually can be relieved with much simpler things, such as getting some sleep, decreasing your stress, you know, fixing your posture, and things like that, and some of the exercises and things like that I'm going to show you guys. One of the big things for these tension headaches that has been shown is environmental factors, right, cause a lot of these headaches. So those stresses in your life. So dealing with that one bad kid, you know, that you have, or if you're a teacher dealing with all those bad kids that you have, or if you drive a lot for work, you know, traffic, or if you work in front of a computer all day, you know, your posture from being in front of the computer. Typically it's outside stress that causes our body to eventually get to the point to where the muscles get worn down and we get that type of pain. Another thing is sleeping habits. So, you know, getting 2 to 3 hours of sleep at a time, not very good for us, right? We don't really ever get into that full REM sleep. So we don't ever really give the brain a chance to relax. We don't really give the head, the neck, a chance to fully relax. It's staying stressed that whole time. And so we're not giving those muscles a chance to sort of release and get good blood flow into them. So this is just talking about the difference between the tension headaches and the migraines. I've alluded to a few of these things, but basically the tension headaches, either side can be affected, right or left, front or back, neck, shoulders, the whole area can really be affected. You're going to have more mild to moderate symptoms. You know, it's going to be just the kind of the pressure. It's going to be just the headache. It's going to be, you know, just those type of symptoms. You're not going to have, like I said before, the nausea, the vomiting. They call the auras with migraines. You're not going to get the auras with the tension headaches. Now, you can get eye pain, but not the whole aura effect that comes with the migraines. Also, one of the big differences is that tension headaches are not going to really be affected by physical activity. So if you're having a tension headache and you go out and exercise, you know, usually it's going to make it better, not worse. Now, obviously, it would depend what type of exercise you do. If you're having a headache and you go do a mountain bike ride or something like that, a bunch of jarring activity, you know, you may get a little bit more of a headache. But, you know, going out and going for a walk, or going for a swim or riding your bike, you know, down the street or something like that. That's typically not going to really change the symptoms that you're having. Migraines, usually it's kind of the opposite way around. You know, physical activity can actually sometimes increase the pain that you get with a migraine. And it will actually increase the amount of pressure that's being put into that area. So we're going to go talk about migraines here. Basically, first, what happens? With a migraine, you know, it's usually going to originate kind of deep within the brain. So you're going to get some type of, it's, you know, not as well known as they would like for it to be, but there is some type of stimulus deep within the brain that sort of triggers this cascade effect. You know, and this is when the auras and those type of things start to become really important, because this is going to be when you can hopefully catch a migraine before it gets full blown, before these type of signals start to originate. Because the second thing that happens is that these signals then spread to the rest of the brain, right? And so now you're over the hill, and momentum's taking over, and it's flowing down. So you're going to end up with a migraine at this point. Now it becomes more of a management issue. What can we do to decrease the symptoms? What can we do to make you feel better? What can we do to try to keep it from getting too bad? A lot of the things that I'm going to talk about here in a minute, we're trying to do this before we get to this point, or we're trying to prevent the body from hopefully getting to this point. So while migraines and tension headaches are different by definition, a lot of the same things will prevent a lot of the triggers that come with migraines. And that's what it's all about with migraines, establishing your triggers and decreasing those triggers. Number 3, so as those impulses kind of flow into the brain, what happens is that nerve activity actually changes the way the blood flows within the brain. It actually causes the blood vessels to sort of dilate and become inflamed, right? This dilation and inflammation basically takes up space. And the space it's taking up, but it irritates some of the cranial nerves, most importantly the trigeminal nerve. And what this does is it basically throws off the whole system in the brain now. So now you've got this inflammation, and this is when why exercise and physical activity sometimes can actually increase your symptoms with a migraine, is because if you go and start exercising, what happens? You're increasing blood flow, right? You're getting the blood pumping around. Well, that's already kind of your problem, right? So now you're sort of adding to the problem, adding to the issue. So that's sort of what we talk about when it's almost too late to try to go that route. You need to try to do the exercise and things before you get to that point. All right, posture. So this is the home run right here, because this is important for every type of headache. This is important for neck pain. This is important for shoulder pain. This is important for low back pain. This is the big daddy. Posture, like I've already kind of alluded to, is becoming worse and worse and more of a problem in our society. There's not very many patients that come in where I don't address posture at some point or time. Posture and body mechanics. How are we picking things up? How do we carry ourselves through our day? You know, and it's simple education. None of this takes a rocket science degree to understand. You know, all it is knowing how your body wants to be and how your body needs to be. So with poor posture, we get what's called sort of an upper crossed syndrome. So this upper cross syndrome is you know, it's pretty straightforward. You get weak muscles at one point, and you're going to get tight muscles at another point. And they're exactly inverse of each other, and they exactly fight each other the whole time. So what happens is, as these shoulders come forward, we get really tight pec muscles. So your pec muscles attach here into the front of your shoulder. As those shoulders stay forward longer and longer throughout our day, we're naturally making these muscles nice and tight. Sitting up nice and tall stretches them out, keeps them stretched out. That's how they're supposed to be. But as we keep them forward, they get nice and tight. Okay? So what's happening on the reverse side? So if these are going to get short and tight, then the muscles in the back of the shoulder and into the shoulder blade area, those are going to get stretched and weak. Okay? Those weak muscles are not going to be able to fight against the tight muscles. All right? So now, let's say now all of a sudden you're like, you know what, my posture's terrible. I need to sit in good posture. Well, now it's hard to sit in good posture, because now you're asking your weak muscles to fight against a strong muscle, right? And your body's not used to doing that. So you might sit in good posture for about a minute, and then you're going to go back to this, right? Or it's the end of the day. The muscles are fatigued. You're tired. You're going to go right back to this. So this is when the education becomes so important, because we have to exercise good posture. And exercise, this posture is an endurance exercise. So just like if you wanted to go run a race, you know, and you hadn't ran a race before, if you just went out there and ran a race for the first time, you're probably not going to finish, right? You didn't prepare yourself for that race. Good posture is the same way. You have to prepare your body and set your body up for success with good posture. So a lot of it is constantly reminding yourself to sit in good posture. Every time you put yourself in good posture, you're working out. You're doing an exercise. That's an exercise. You're firing your shoulder blade muscles. You're keeping those shoulders back. You're stretching out your pecs a little bit. The other thing that happens too is up in the neck. So what happens up in the neck is the paraspinals, or your upper traps. It's basically all the muscles that attach in the back of your neck and to the base of your skull. They get tight as well. So just like your pecs get nice and tight, that the back of your head gets nice and tight. And this is because as those shoulders come forward, it causes our spine to naturally want to look down. So it makes the head look down. Well, we have reflexes in our body, and naturally we want to see what's going on. So boom, we pick our head up, right? So now we've put pressure right into the back of our head. So now, just like these muscles got nice and short and tight, now these muscles are getting nice and short and tight. And then what did we talk about earlier? That triangle, right? That triangle's back there. So now those muscles that make up that triangle are tight, so they're getting smaller, right? That space is getting smaller. So now we're sitting in this posture for any extended period of time. We're decreasing blood flow to the brain. We're irritating the nerves. There's your tension headache. There's your chronic tension headache. You know, there's your trigger for a migraine, things like that. This is, and it's such an easy thing to fix because all it is, you don't need any special equipment. You just have to think about it, right? So I'm going to show the exercises I'm going to show you are going to focus on this sort of syndrome right here, this upper cross syndrome. If we can fix this alone and really hone in on this, you're going to decrease. You're not only going to at least decrease your symptoms, but you're going to decrease your severity and decrease your prevalence of getting these headaches, getting migraines and things like that. I've seen it in all my patients. Whether I've had a patient who comes in and we can't have the lights on, you know, to a patient who, yeah, I get headaches every now and then and my neck kind of hurts. Both type of patients have had great results from just addressing these issues right here. And the reason being, you're restoring the body back to its normal motion, its normal flow. You're getting the blood flowing back to how it's supposed to be. You're putting the spine back in its normal order. You're decreasing your chance of having a neck herniation later on down the road. Because if you're like this all the time, now you're putting more pressure on your disc, right? And then if you just want to go down the whole chain, now you're like this. So this is more curved here. So now your upper back's going to curve more, which means now your lumbar spine's going to have to curve more, which means now you've got a low back issue. Right? So now when you walk, it hurts. Okay, you're walking, it hurts when you walk now because your back is off, so now your hips are off. Okay, so now your foot hurts because you're walking differently. So now your neck just connected to your toe pain, right? So, and it's all connected, and because our body works like that. Our body works in a chain. It's like a chain link fence. If one link is out, the whole fence is shot. So you have to fix that whole chain, and this is where it really starts. So one of the big things is the workstation adaptations, or, you know, how we, you know, the positions we put ourselves in. And while this is mainly looking at like the computer, I also address driving as well. You know, I live in St. Augustine, so I do about a 40-minute commute home and here to work every day. And, you know, I really noticed with my commute, my posture while I was driving on my back pain. And while I don't really get headaches or anything like that, I would get sharp twinges and things like that in my back at the end of the day if I was in a really bad posture. And so, you know, the upper left picture there is basically somebody in terrible posture, and all those little arrows are just basically pointing out all the spots where it starts to hurt. And so you can see it can hurt all the way from the wrist all the way into your butt, right? And it's all from the same problem. So wrist and butt pain related as well. The picture all the way to the right, that's how ideally we would love for everybody to be. So whether you're working at a computer or driving or sitting in a chair listening to a lecture about headaches or anything like that, right? This is the ideal way we would always want everybody to sit. And the ideal way is whatever it is that you are focusing on, looking at, or anything like that should be about eye level. And it should be directly in front of you. You shouldn't have to turn your head at all. You shouldn't have to have your look down, and you shouldn't have to look up. It should be directly right in front of your vision. The second thing is your arms, right? Your arms, as far as where are you placing your arms. So arm rest. One of the things with driving that I really noticed is, you know, we're all taught to drive 10 and 2. You know, arms up here, 10 and 2, gives us good control of the steering wheel, which is very true, exactly. But what does that do? As soon as I put my arms at 10 and 2, my shoulders just came forward, right? Just put pressure into the back of my neck, and now I'm going into that posture. I can't drive 10 and 2 on the way home. So what I've started doing is I started driving more of like a 5 and 7. So bringing the arms down, right? I still have 2 hands on the wheel. I still have excellent control. But what I've done is I've dropped the arms down now. Maybe I'm resting, I can get my elbows to rest on my thighs. Things like that. You've taken the pressure out of the muscles in your shoulder, and you've put those the shoulder position back to where we want it to be, into that good posture type of position. So I really promote, especially people who commute a lot, to play with it, and play with that type of driving style. The other thing is your feet. A lot of people will either have to reach down with their feet because their chair's too high, or maybe their chair's too low and their feet are too high up. And that puts a lot of pressure down into the low back, which, just like the neck can cause toe pain, or where your feet are can go on up and cause neck pain. So they go the same way. The other thing is overcompensating, right? So now you have bad posture, or you think you have bad posture. So now you really sit up tall and you really stick the butt out, and now you've overcompensated. So now you're almost being just as bad. So it's a matter of really finding the good posture. And the big problem with the overcompensating is not giving yourself the low back support. The low back support becomes important because that's what gives the spine the stabilization, which is going to help stabilize the neck, which is going to decrease your triggers or possibility of getting headaches. Okay, so why is physical therapy important? So as far as treatments go with patients who come in with headaches, the big thing is neck mobility, right? So if those muscles are tight, we stretch them. If you have an underlying joint, problem where the joint's tight and it doesn't allow you to move the neck, we fix it. If muscles are weak, we strengthen them, so on and so forth. And we address each area until, you're able to be in good posture most times of the day, or it feels weird to be in bad posture. You're like, oh yeah, I was in bad posture for a few seconds and I noticed it. So I sat back up and I felt better again. And once again, it's an endurance event, right? So the more you sit in good posture, the easier it becomes. The more your body gets used to it, and the more it's gonna wanna be in that type of situation. So self-treatments. So here's where we're going to start to kind of get into the meat and potatoes of it. I talked a little bit about it already, but sleep can't talk about sleep enough. The sleep is what allows our body to completely relax. It allows the muscles to completely turn off. It allows all these type of things to sort of get a nice refresh, restart button. One of the second things is biofeedback. Biofeedback is really kind of becoming up and coming as far as using that to treat headaches, especially migraines and things of that nature. Because biofeedback is basically telling you, when you think you're in good posture, are you really? Right? Are you really relaxing the muscles we want to be relaxed? You may look like you're in good posture, but you may just be compensating and using a different muscle. So biofeedback is we are able to place the pads onto the muscle and see, are these muscles firing? Are they not firing when we want them to be, and so on and so forth. Ice and heat, always get the question, should I use ice or should I use heat? I say both, right? Use both. Which one do you like better? All right. Or if they both feel good, all right, we're using both. Because they both are going to have beneficial, and they're both going to have cons. Ice obviously is going to decrease any type of irritation or inflammation that you're having. So if you're having a killer headache, throw a little ice on the forehead, put a little ice on the back of the neck, especially if you're having a tension headache. Where your little triangle is right where the base of your skull. Put some ice right there. It allows those muscles to relax. Boom, there's your blood flow coming back, headache gone.